Sorry about that. We just had a technical issue. But this is the USMLE Sarthi team, and we are live on YouTube. This is a series of webinars that we will be doing, and we'll be talking about all aspects of math. So the first webinar on this series is on research. So we will talk about why research is becoming important for IMGs to match. When can they get started? What should they be doing? How can they get started? And what type of research projects are important? So having said that, let me introduce Dr. Achint Patel. He's a resident in internal medicine, and he'll be talking about it, and he'll be answering your questions. So welcome, Dr. Patel.
Thank you, Pawan, for inviting me.
So let's get started. The very first question is, why is research becoming suddenly so important for the IMGs?
So that is, question of interest for lots of people who are, especially those who are trying to match into residency, and they have a few red flags. Okay, so I have like few points I can tell you, why research is becoming more and more important in order to match to a residency. So first of all, many students, many USMLE aspirants have law scores or law graduation years. They have passed medical school like few years back. So in that sort of candidates, it is very much important to have extracurricular activities, and research is one of the most important activity to fill in your gaps. And then if you have like law scores or failed attempts, then and if you excel in doing research, in that case, you can try to cover up your negative remarks or negative, law scores by doing like lots of research. And now from next year, I guess the USMLE Step 1 exam is gonna be pass or fail. Yes. CS is already out, and OEP is there, that is also pass and fail. So now only we have one exam, that is CK, and that exam will have a score. So programs will only have a, one score to judge among different candidates, right? So it is more likely that they will gonna focus more on extracurricular activities like research, clinical experience in the US. So that's why research might be even more important, play a more important role from next year. Then there are many other scenarios where research can benefit to the candidate. So many programs, they have a on-site research, and they encourage residents to do research. And some program directors like the residents who are doing research. So, if you have like some research experience and you can do your own research or independent research as a resident, then you are more likely to be selected in that programs. I'm not saying like all programs have that, but there are many programs where they need residents who can do research. And so that is there. That's why research is important. ACGME, like ACGME requirement is that each and every resident is required to do at least one scholarly activity. So it could be quality improvement project, or it could be like any publications. So that is mandatory by ACGME. So all residents are required to do at least one research. And those candidates, those residents who wants to apply for fellowships, so fellowships is all about research, because once you are in residency, then the only fellows and only research, extracurricular activities, scholarly activities that will gonna, help you to get into good fellowship. So these are the few points like important for, why research is can play important role in your, medical career in the US.
Okay, so let me just summarize. Research is important not only to match into USMLE residency, especially if you have low scores, red flags, or any other thing, but it is also it will give you an edge regardless. And then secondly, research is also important during the residency because the expectation or the CGME requirement is to do a scholarly activity, which could be research or QA projects. And then, of course, if you are interested in fellowship, research is all the more important. So there are multiple reasons why research is important. And I think the most important reason which you pointed out was the step one going pass fail. CS is already out. So the programs in order to evaluate the IMGs are only left with CK, especially recent graduates who may not have taken step three. So those are very good points. And let me take a break here and introduce, I did not do formal introduction to you, Dr. Patel. So Dr. Patel is a very prolific researcher. You should look him up on Google Scholars and you will see the extent of research that he has done. He's also, he teaches research for our students, and we are starting our next research course on November 21st. The enrollment is open. You guys should look at that course on our website, and I will have a link to that. So that that covers all aspects of research, and then we have hands-on projects that can lead to publication. But I also wanted to introduce Revant, who has joined our team recently. So Revant, do you want to introduce yourself? Where are you coming from, and where are you in the USMLE journey?
Yes, sir. Thank you for the introduction. So I'm Revant. I'm a medical student. I'm from Hyderabad, and I did my step one, and I have some clerkships coming up next year. So I just joined the team. I'm glad to be a part of the team. So
thank you, Revant.
Also coming to research. Yeah, sir.
Yeah, let me. Yeah, actually, that's a good segue to the question. When should medical students start research? So I'll first go to Dr. Patel and then I'll come to you. So someone in, let's say, in medical school, and I'm getting these questions on YouTube also, when should they start? Should it be after step one, or which year of medical school? I think Vanshika is asking this question. So Dr. Patel, I'll go to you first. When should students start research initiatives?
Well, I would just say like whenever student get into medical school, they should start thinking about doing research. So now we have to understand one thing. Now medicine is not about reading books. Okay, now everybody is like the whole medical field is going towards evidence-based medicine. Okay, so understanding research, learning research, learning about scholarly articles, how to interpret new studies, clinical studies, clinical trials, is not just to match into like residency or fellowship. It also helps you to become a better doctor. Okay, so as soon as you get into medical school, you should develop these these research skills along with your med school. Okay, and I mean. I understand like it might not be possible to get the opportunity to do research during the initial years of the medical school. But I would say like whenever you are in third or fourth year, you should definitely start thinking about, at least learning research. And whenever you get opportunity, you should start doing, research.
Okay, thank you.
Yeah.
And Revant, now let's get to your experience. You were able to do research while in medical school and you were able to publish. So talk to our audience on how you did it, what kind of research they can do. If they are in India, I think there is ICMR, things like that. So how should they go about it if they are in medical school?
Yes, sir. So I did my research when I'm in my second year of medical school itself.
Okay.
So what I did is approaching the professors, especially so in the first year and second year of medical school in India comprises mostly of uh, preclinicals. So I thought of maybe I have to start my research from preclinicals itself so that I'll get some exposure. So I'd say the better time to approach the professors to be part of a research team is in second year itself. So by the time we reach the third year, that's when the clinical year starts, we can ask the clinical professors that we already have some experience in the second year itself, and so that we would get much better opportunities from third year. That's one thing which I did in my second year. And also, so in before doing the publications, what I did was I presented the research project in various undergraduate conferences out there. So that helped me uh, to get engaged with the professors and get approached to professors, and they understood that this person is genuinely interested, and they gave me more opportunities.
Mm.
And that's something which I did. So
Okay. Um, Thank you. And I am getting a lot of questions whether US publications matter or not, whether case reports matter or not. So let me take to the next question, Dr. Patel. Talk to us about various types of research projects or publications, so that the students understand the difference between manuscripts, case reports, and then US based research versus outside of US. Talk to us about those things.
Yeah, sure, Pawan. So, guys, research is, research, okay? And research doesn't have any borders. So there is nothing like Indian research or, Chinese research or Japanese research or American research, okay? So everything count as a medical research, okay? And it doesn't matter from where you are doing research. Now back to the main question, what are the types of clinical research? Okay, what are the types of medical research? So there are two types broadly. One is benchmark, like lab-based research. Okay, that focuses on basic sciences, and the second is clinical research. So we are as a physician, we are more towards clinical research. Okay, like there are many people who work as a they make career for basic science research, but that's not our concern right now. So we mostly focus on clinical research. Okay, so there are different types of studies, different types of clinical research, I would say, and different types of articles that you can publish by doing different types of research. Okay, so I would start with number one is easiest research is case reports. So whenever you guys see any interesting case, interesting presentation, or that patient required different types of management approach than the usual management guidelines, in that scenarios you can try to summarize your case and try to publish that study as a case report. Okay, or whenever there are more than one patients, you try to publish as a case series. So that's the one type of clinical research, and one and that yield in a one sort of case report or case series type of publication. Okay, the second is original research. So original research is basically, there are different types of studies like retrospective studies, prospective studies. Clinical trial is also one of original research, but that's, as a medical students or residents, that's beyond our capacity. So we mostly focus on data review, like data gathering. We gather data from our hospitals, try to analyze that data to answer a specific research question. And we conduct that specific retrospective study, and we try to publish original research article. Okay, so when I use the word article, that also synonym is like manuscript in a scientific language. All right, so manuscript or research article is the same thing. So this is second type of research, like original research. Okay, the third is review articles. Okay, so
Okay.
in review studies and review article, what we do is we, review the prior published articles in a specific topic and try to, set a specific narrative about the specific research questions and try to publish review articles. So there are like different types of review articles: systematic review, literature review, meta-analysis review article. So these are like three types of research that we mainly use as a medical student or resident: case reports, case series, original research articles, and the third is review articles.
Okay. And I am getting a lot of questions on YouTube around, PubMed journal, PubMed index journals and others. So can you also talk about the importance of these publications? Why the PubMed index journal are, I guess, more important in your residency application than others. So
Okay.
can you talk a bit about this indexing and journals, and what type of journals are considered important here for USMLE journey?
Yeah, sure. So, so whenever we conduct any clinical study and we, conclude our study and then we write down the article, right? Now we have to publish that article in any form of media, okay? So these journals, conferences are basically mediums of publications. So this is like whole different, different aspect of research. Like publication is itself, like where to publish, which journal to choose, whether we should go for conference or journals. That's a separate entity. So now the question is, there are like lots of journals, like as there are lots of newspapers that we read, or lots of like magazines we read, in general life. Similarly, in medical field, there are lots of journals, lots of magazines. All right. So there is nothing like one journal, is good for USMLE and the another journal is not good for USMLE. Okay.
Yeah.
You are at the level of medical student and applying for residency. So at that level, it doesn't matter much about the which journal you are publishing. But as a quality, okay, if you are doing some sort of quality research, definitely good journals are important. So how you decide whether this journal is good or not? So for that, so all these journals are, regulated by certain scientific agencies, right? And one of that agency is PubMed. So PubMed is not a journal. Like many students think like PubMed is a journal. So PubMed never publishes. PubMed is just a library, okay? So that library basically manages all journals and their articles, all right? So PubMed is like US-based library. There are like different libraries for European countries. There might be different library in China. There might be different such library in Japan, okay? So mostly we go for like Europeans and the US-based libraries because we are trying to mostly publish in English, right? So their journals are basically indexed in mostly in PubMed or sometimes in European libraries. So as a like if I'm applying for the US, definitely I would think like, okay, I will choose a journal which is like indexed or regulated by PubMed. Okay, so so that's why it is always good to publish in a PubMed index journal, but it has nothing to do with your matching in a residency. Okay, your program directors is not gonna think, hey, like why you didn't publish in PubMed journal and why you publish in like some European journal. It's not the logic. Okay, they will focus on research. They will focus on what you did for that research. Do you have that skills or not to do independent research while you are in their program, right? These are the points you should focus, like on research itself rather than journals. But definitely, if I'm trying to publish, I will start with the higher journal or journal of the target will be like PubMed index journal, but you shouldn't be obsessed with that PubMed indexing journals.
Okay.
And this happens like normally in any research studies. Like all research might not have that innovative ideas. Okay, so like if I'm working on like case reports, literature reviews, these are not like that much innovative ideas. So good journal like JAMA or NEJM, like they are the gold standards of medicine. Okay, so they are not gonna be interested in your research, right? So you will go for like medium impact or low impact journals where you can get the timely publications and you can show off that hey, I did research and I have this experience when you are applying, right? So everything matters. So you have to think smart when you are trying to publish.
Okay. Revant, let me go to you now and talk to us specifically if you are aware of opportunities for Indian medical students like the ICMR scholarships, or what are the opportunities available to the students in India? And then we'll talk about, Dr. Patel's course as well.
Yeah, so every college has this access to ICMR, sir, like how my medical college had access to ICMR. It's like every medical college have access to ICMR. And usually ICMR offer is, so usually what students do in medical school is they approach a professor and the professor and the student combinedly come up with a research topic, they formulate and they send it to ICMR. So that should be done only through a professor, but the student alone cannot do that. There should be a professor mentor, and usually the professor who will be involving in the research will be the most common professor whose projects will be accepted by ICMR. So once we approach the ICMR, if the ICMR like the project, the ICMR funds the project. So so that's something which is which is considered as very valuable research out there, and this is easily accessible to a lot of students. And there is one more thing, this is actually a bit difficult thing which are going through ICMR, but there is one more easy method. Like most of the medical colleges right now, like these days, actually have their own journals. So for example, my medical college has their own journal, and that journal is a PubMed index. So what happens is, so when a medical college has their own journal, it will be easy for the articles which we take to them and ask them to publish. It will be easy for us to get published. And since if the medical journal is also PubMed index, like how Dr. Achit Patel said, that's of course it's beneficial. So the students can also try on the second method.
Okay, thank you. So Dr. Patel, talk to us about your teaching methodology and what do we cover in the course?
Yeah, so before I answer that, I wanted to, talk about like what is, independent researchers, okay?
Yes.
What is being independent researchers? So
Right.
as, Revant told us like his story, like how he initiated doing research, okay? So he did it by himself, right? Obviously, like he approached his clinical professors and he got mentorship from them, but he initiated by himself. So, so that quality is very much important. Like, so as a medical students, like everybody is not that fortunate that, your medical school will have journals and, professors who are doing research, right? So, I mean, in my med school, there was no like journals or like there was zero research. So, so for those, I mean, you don't have to sit down and wait like, hey, like whenever I will be going to US, I will do research. Okay. So you can start your own research. You can start learning your, research methodology, how to do research. You can start developing their skills. And whenever you get opportunity, to work somewhere, your skills will strengthen, right, over the time. More and more experience you will get into the research or in publishing, your skills will gonna get sharper. Okay, so that being an independent researchers is I would like recommend to everybody, like all medical students. I myself, like I did masters in publication. That's where I learned these research skills. But I continued, improving my research skills. I continued engaging in lots of research, and and eventually, I was able to like publish lots of articles. So like everybody has to start. Like when I moved to US, I had zero research. Now I have like several research. So everybody has to start from zero. So, but to reach from, like start from 0 to 1, you have to acquire some skills. Okay. So that's what like I was wanted to say. So now back to your question. So there are like lots of methods like how you can learn. Okay.
Correct.
Number one is you enroll in masters in public health or masters in clinical research. 2 years whole master's degree program to learn about how to do research. Okay, that's like one way. That's what I did. The second is you enroll in a research programs, like short research programs or certificate programs where they will wanna teach you like the basic fundamentals of how to do clinical research, and they will at USMLE we also give students opportunity to do the practicum, like one research project, group research project on a specific topic. So that experience, once you go through this process, definitely you will acquire some skills. The third thing is you use Google. So nowadays, like Google is itself a medical school. So, so you can start using Google, type down like how to do research. Google will tell you everything. Okay.
Uh-huh.
So if you think that you have self-motivation, you can always use Google as well to learn how to do research. So there are lots of, materials available, and depending on your capacity and depending on your scenario, like on which stage of residency application you are, like you should try to get the like best way out of the to get into like research field.
Okay. As we wrap up, let me take some questions that I'm seeing on the YouTube now. So some examples of medium impact journals. Do you have some examples, especially when it comes to internal medicine? Dr. Patel?
Yeah, can you repeat your question?
So some examples of medium impact journals.
Okay, so I mean, so impact factor is a quality scale. Okay, so higher the impact factor, that means that that journal is more impactful. Okay,
Mm-hmm.
if there is a less impact factor, that means that journal is less impactful. Okay, so that journal and how they decide like whether it's more impactful or less impactful. So that is based on the quality of research articles they publish. So just for example, NEJM, so New England Journal of Medicine. So that's has the highest impact factor in the field of general medicine. Okay, that's for general medicine. That is not the gold standard or highest impact journal for cardiology. That's for medicine. Okay, so each and like all subspecialties, they have their own high impact factor journals. Okay, so there is no like NEJM impact factor is like around 80 or something like that. And the highest impactful journal in cardiology, if I would say, the Journal of American College of Cardiology, it has like impact factor of like 30 or 32. So there is nothing like, predefined criteria say like this impact factor is like medium, higher. So it depends on the field as well. That's what I'm trying to say. But usually medium impact factor, most of the journals, like 95% journals will hang around, 2 to 5 impact factor. Okay. Only 1% journal will have beyond 5 impact factor. Okay. And like few journals will have like below 1 impact factor. But usually, so medium tier journal, I would say like 2 to 7, 2 to 5.
Okay. One more question that I'm seeing. I don't think there is an exact answer to this, but maybe you can answer this. Muhammad Ala is asking, there is a national interest waiver due to research publications in the US. Is there a specific number of publications? I think this is around the green card using national interest waiver. Is there a number? I don't think there is a specific number.
So yeah, this is like very good question. Okay. So when I came to the US, I didn't know that how research can be helped like beyond your residency or fellowship. Okay. So those IMGs, those non-US IMGs, those who are coming to US on visas, all right. So eventually you will require green card or PR to stay in the US, right? To practice in the US. So mostly we go for, if you are on J1 visa, you go for, J1 waiver sport or H1B visas, and then hospitals will be sponsoring your green card. So now, depending on your country of birth, like India and China is like kind of, backlog in a green card process. But other countries, the rest of the world is not that backlog. Okay. So there is a research-based categories where you can sponsor your own green card, and one category is this national interest waiver. Okay, so if you have like certain amount of research, like 5 to 10 publications, and that research articles have a certain amount of citations, like other people's have used that your research articles for their own research, like around like more than 20 to 30, then you can basically qualify for this national interest waiver. But I am not the lawyer, so immigration lawyer could be able to answer this question, more precisely. This is from my experience. So but this is like good point. Like those who are like coming US on the visas, this research will also gonna help you to get the faster and easier green card as compared to the traditional route.
Okay, there's a question from Shubham that we just answered. I'm a third-year medical student, just did step 1. How can we start research and how to look for topics? So I think both Dr. Patel and Revant just answered it. So I want to wrap it up by saying this is the first in the series of webinars. In the coming weeks, we will do webinars on various aspects of the match. So today was the research aspect. And do look up our website, our research course, independent research, for all aspects of teaching and publication is starting next week. So those of you who are looking for independent research and possibility to publish, we'll be happy to talk with you as well. With that, I want to just thank my panel, Dr. Achint Patel, Revant. Thank you very much and appreciate your time. And good luck everyone in their residency journey.
All right. Thank you, Pawan. Good luck, everybody.
Thank you. Bye. Bye.